Hi, everyone. We're going to continue here and finish up the chapter on cognitive therapy. And when we left off, actually just this afternoon, we're just wrapping up Ellis's idea of rational emotive therapy, where the goal of therapy is to help clients connect the irrational beliefs they have to the unhealthy emotions, depression and anxiety, and teach the client to replace those with rational beliefs. I mentioned the counselor, and you'll see this in the Gloria film, is challenging, persuading, confronting, pretty assertive about getting the client to test out their beliefs. And I want to end actually the Ellis section by just showing you a few of the things. Let me enlarge the screen here. A few of the things that he had written, which are kind of interesting. So he wrote books on they're really self-help books: overcoming destructive behaviors, feelings, a guide to rational living, how to make yourself happy. So these were pretty popular self-help books. And then he also wrote an unusual book that you're going to hear Gloria mention to him, and that is The Intelligent Woman's Guide to Manhunting. So that's pretty much the problem she brings in to Ellis once you watch that video, and you'll see the techniques that we just talked about with him really come to life. I want to do just a quick wrap up of rational emotive therapy, just a little bit of an evaluation. So, one of the things to keep in mind here is that it really is best for higher functioning clients. So, it doesn't work all that well for clients who may have some differing ability levels. It's really not good for kids. It's not meant to be for kids because they're not able, if you think about Piaget's theory, you have to be able to reason at formal operations. Adolescents, usually it works just fine. And it gets, this kind of therapy gets really good results for things like lots of time, lots of kinds of anxiety, things like speaking, social anxiety. It's good for assertiveness, good for self esteem. So there really are lots of things that this can be very well suited for. We're going to go on then and talk about a second kind of cognitive therapy. So, cognitive therapy is a broad term and it includes rational emotive therapy and what we're just going to call Aaron Beck's cognitive therapy. And he just died in 2021, so he had just turned 100. He was like a couple of months past 100, so he very recently passed away and was pretty active toward the end, well into his 90s. So there's a lot of similarities to Beck's theory. It's similar to rational emotive therapy, but in a way it's different because rather than a teacher-student relationship, which is what Ellis assumes, Beck sees cognitive therapy, CT, as really a collaborative effort. The client and the counselor are supposed to work together to help the client. They're like investigators. Let's seek out what your dysfunctional beliefs are. We'll find them together and we'll try and solve them. So they seek to uncover the client's dysfunctional cognitions and the underlying assumptions which are harmful. And he assumes things like errors in reasoning, not necessarily irrational beliefs that are planted into your head. His theory talks quite a bit about cognitive distortions, which are similar to irrational beliefs, but beliefs are a particular thought. I have to be perfect at everything. Cognitive distortions have more to do with reasoning errors. So you come to conclusions that aren't correct. And we'll see a little bit of the difference here in just a few minutes. Um, when as you're watching this, or you can go back to the PowerPoints, just the regular PowerPoints that aren't recorded that I've got on Blackboard, and I'd like for you to watch just a couple of minutes of this video to get a sense of what Beck's style is like. He's not nearly as confrontational or directive or kind of preachy like Ellis is. He's just much more collaborative. So I'd like you to take a look at that. All right, well, let's talk in some sense about what some of these cognitive distortions are. I'm going to just run through a couple of examples, but they've got some more in your textbook that I'd like you to take a look at just to get some ideas. So, one type of cognitive distortion that we make is something called arbitrary inference. This is when we reach conclusions from a lack of evidence. So, for example, if I'm teaching and I see a bunch of students just on their phones, which certainly happens, or just really looking bored, I may automatically conclude, oh, I'm a terrible teacher. If your friend is acting a little bit cool towards you one day, your conclusion might be, okay, oh, they must be angry at me. That's what arbitrary inference is. You jump to a conclusion without having any kind of evidence to the contrary. We also use things called magnification and minimization. And my mom used to tell me when I was growing up, if I get upset about something small, she'd say, "You're making a mountain out of a molehill." That's really what this is. Small bad events we tend to inflate and make them worse in our minds. So if you get a poor grade on a quiz and you're really fussing over it and really upset about it, in the scheme of things, it's probably not that big a deal. But your cognitive distortion is to make it out to be a big deal, and then it's upsetting to you. And then large positive events are discounted. So this could go all together. Maybe you get a low grade on a quiz, but all your exam grades and paper grades are really good. So magnification and minimization oftentimes go together, and you might make the conclusion that you're doing poorly in that class because you got that one low grade, but that's not true, and that really is an error in reasoning and a cognitive distortion. Just one other example of this is dichotomous thinking. So we either see experiences as good or as bad. So if it goes one way, it's good. If it goes another way, it's bad. So for example, if you're trying to eat healthy and you have an ice cream cone after dinner and you conclude, "Oh gosh, I'm not eating healthy anymore. I've ruined my healthy eating plan." That's dichotomous thinking rather than seeing things as more gray or in the middle. Same with the test. If you don't do well on a particular test, you either have to get an A or you bomb it. And we've certainly had students like that. If they don't get A's, they think they practically failed. So that's dichotomous thinking. And as you can imagine from those examples I just gave you, that could make you pretty unhappy if that's how you think. Let's talk a little bit more about automatic thoughts here, which is something that Beck talked very much about. And these really are very similar to Ellis's irrational beliefs. These are beliefs or assumptions that develop very early in life. And one way to think about it is that these are stories about ourselves that we carry around in our heads. And they kind of operate in the background of everything that we do. So no matter what experiences you go through, you've got this kind of thing in the back of your head. And here are some pretty good examples of this. I'm not smart enough. So in so many situations, you just have that in your head. No one respects me. People don't like me. I'm not lovable. So they call them automatic thoughts because in a lot of situations that we encounter, those are some of the first things that come into our head. And of course, those are going to make you really unhappy. So in Beck's theory, he talks about using this type of therapy to counter automatic thoughts as well. So speaking of that, let's talk a little bit about Beck's method of cognitive therapy. What he engages in is something called collaborative empiricism. And this is, I mentioned this at the beginning of talking about him, but this is a kind of therapy where we work with the client to help sort of hypothesis test the validity of their beliefs is a way to think about it. So if your client talks about just never being smart enough, never being good enough, then you start asking them questions about, give me some evidence, give me some situations where you weren't good enough. And of course, they may have a couple, but chances are pretty good people really exaggerate things as well. So eventually, they'll be able to come up with a number of situations that run counter to that belief that they're not smart enough. And you can help them see really the validity or the invalidity of the things that they believe. So you and the therapist and the client are really co-investigators. You are seeking the evidence together to these automatic thoughts that are making clients unhappy. Here are some ways to do that. Some of the techniques that are used is catastrophizing. So we already talked about, or decatastrophizing, I should say. We already talked a little bit about catastrophizing. And so catastrophizing is jumping to a false conclusion. Sometimes that's used when people use arbitrary inference. So to decatastrophize, you say to people, you talk in terms of what if kinds of statements. Okay, what if you take a job and you find that you're not smart enough? What would happen then? And then the client will answer you, and you could say, okay, let's say that happens. What would happen then? And so it's kind of a type of questioning that helps clients see that generally the worst kind of thing they can think of is very unlikely to happen. And sometimes people need the assistance of a therapist to help them do this. Beck and his theory, they also use something called Socratic dialogue. I am linking a little video clip. If you go to the actual PowerPoint slides on Blackboard, you'll be able to clip this, and it's a good example of a therapist using Socratic dialogue. So these are questions to lead the client to a more logical conclusion than what they have been. So if a client is saying, I'm a terrible parent, I'm a bad parent, my kid is not turning out very well, you can come up with, it's a general spiraling kind of question to lead the client to a more logical conclusion. So if a person thinks that they're a bad parent, you can start asking them about examples. Okay, what's the evidence that you're a bad parent? And then what's the evidence you're a good parent? And chances are pretty good you're going to be able to lead them to understand that a few bad things that happen with your kid does not make you a bad parent. We also can use a technique called the reattribution technique that allows us to help clients examine alternative causes of events. So, say, for example, I've got a specific example here. Someone comes in and they're talking about problems in their relationship and mentions that their spouse or partner is just really backing off, being distant, and so they assume they want to separate. They assume they don't like them anymore. So, some of the things that you could ask the client are thinking about what are some other things that could be going on? Why else might they be acting so distant towards you? And you can really encourage them and help them look at other possibilities for the situation. Okay, so that's just a brief glimpse, just a little bit of highlight of cognitive therapy from Beck's point of view. To sum up this chapter, I want to point out that cognitive therapies are useful for an awful lot of different things. They are very good, as I mentioned earlier today, for the treatment of depression. They are excellent for anxiety, really good for things like social anxiety, social phobias. They are used in eating disorder treatment because folks do not think rationally, oftentimes, when they're dealing with an eating disorder. And then it can also be used in substance abuse treatment. Many times, people who are in treatment for substance abuse, they don't have good coping mechanisms, they don't have good problem solving strategies, and they also have a low opinion of themselves to be able to solve problems. And so, cognitive therapy can be very successful in helping with that too.